Well, here I am in the beautiful outdoor nature, here with Caring Matters. I am Jackie Hickey. I am the Community Health Advisor with Bayshore Healthcare. And my role is to get out and help support family caregivers, educate, and help people manage their health. And our topic today is good foot care and the key to happy feet. And after being a registered nurse for 27 years, I've slowly started to realize how important these topics are for people to help maintain the better health that everyone wishes to have. And as we go down that aging journey, the key is to be able to have all these tools in our toolkit in order to be successful. So I wanted to talk about health and health management, and the topic of foot care seems to be extremely important. We need to have better foot care education. We need to understand why having good foot care is important. We need to have the convenience of foot care in the comfort of our home. And we also need to have healthy feet in order to have happy feet. I wanted to talk a little bit about foot health awareness. Now, May actually is Foot Health Awareness Month. And just some interesting statistics. We have within the human foot 26 bones, 32 joints, 107 ligaments, 19 different muscles and tendons, and 52 bones. The 52 bones in our feet make up actually 25% of all the bones in our body. So if we think about how important these two things, these two structures are at the bottom of our body that we put so much weight and so much stress on, it comes better for us to learn more and understand how important healthy feet are. A couple more statistics that I think are interesting. If you look at the amount of absorption that the foot takes on, and it's over about 1 million pounds of force per day. There are 250,000 sweat glands in our feet. And millions of bacteria can be found also in our feet. So again, some of the things that I'm going to talk about when we talk about tips and tools in order to have healthier feet and take care of our feet might make sense when we think about some of these numbers. So the other thing that I did want to talk about a little bit is the structure, and I'm not going to go into too much depth, but our feet are really a flexible structure, and it's because of all those bones, the joints, the muscles, that soft tissue that help construct it. And it allows us to be able to stand. It allows us to be able to perform activities as simple as being able to get up and walk, run, jump, play, and do these exercise and these activities that are so important for the rest of our body's good health and well-being. The structures of the feet, there are different components. So there's a forefoot, there's a midfoot, and a hindfoot. And again, within that foot, there's all those structures that I mentioned earlier. And if something were to happen to one of those structures, one of the joints, a tendon, a ligament, a bone, it really does have a great effect on the health of our feet. If we talk a little bit about some of the conditions that we can have that are related to the feet and individuals' ability to maintain healthy feet. And I wanted to touch, there's quite a few of them, but I'm going to touch on some of them, and I'm going to talk about a couple of them in depth, because I think people do experience this and they may not realize that something is actually going on with their feet. So I wanted to start off with plantar fasciitis, and this is a term that sometimes people may have heard of. And if we talk about things like inflammation, inflammation is a swelling. It's a specific area of the foot that tends to become inflamed. It's actually the plantar fascia ligament that becomes involved in this area. And when people start to feel pain and discomfort in a certain specific area on the foot, it can be related to this particular condition. We also talk about things like osteoarthritis, and there are a lot of different types of arthritises out there. Osteoarthritis is really the wear and tear of the cartilage that is so vital between bone. So ultimately, we don't want bone to be connected and rubbing against each other. But in time, as that cartilage wears, we start to feel that friction happening between the bone. So again, people may experience things like pain. Pain is not a normal feeling that we should be feeling within our feet. Another condition that tends to be common for a lot of folks when we talk about the feet and individuals is something called gout. And again, gout is an inflammatory condition where crystals, deposits of crystals form within the joints. So again, the joint should be a free-flowing movement, and anything that interferes with that, again, will start to cause pain. Individuals that may have experienced gout will truly be able to share the pain that they had felt. And as soon as that condition and the treatment for that condition starts, the individual almost feels 100% relief. Other things that people may experience are athlete's foot, and we encourage people to help maintain good health. And one of the things that I do talk about is going to the pool and either swimming or doing some water aerobics. Very good for those of us that have problems with our bones and our joints. And it's a very good way to exercise and maintain good health for the body. But we're walking on pool decks. So I always recommend that individuals wear proper footing, proper shoes, deck shoes that they can wear at the pool. Because athlete's foot is a fungal infection that a lot of times gets picked up as we go into certain areas where there's moisture and wet, and pools and pool decks can be a very common place for that. Rheumatoid arthritis is another condition that people will experience. It's an autoimmune form of arthritis. Bunions, another condition that people will develop, and it usually happens on a bony prominence and next to the big toe, and it's really a protrusion, a lump, something that people look at their feet and they say, now that I didn't have before, and it is an unusual change to an individual's foot. Achilles tendon injury, again, these are seen sometimes when individuals start to become active, and maybe they weren't active for a certain period of time, and they think, well, I'm going to get my running shoes on and I'm going to start jogging after 10 years. But we have to ease into these things. Achilles tendon injury, otherwise known as tendinitis, which may be more of a common term, is usually pain in the back of the heel, and it really is affiliated with that Achilles tendon. Other people may experience things like edema, otherwise swollen feet. And edema really is a condition, a swelling of a certain area that can be related to other things. Injury, so we hurt ourselves, we bang the soft tissue, and all of a sudden we get a nice little bump swelling. Within the feet, if we develop edema or swelling within the feet, and as it moves up the leg, it can be conditions related to other diseases of the body, more significant diseases, things like heart disease, kidney disease, liver problems. So again, it's not normal, and if we start to see signs of that, then again, it becomes important for us to take note of that. Other conditions, calluses, corns, these types of things, again, tough skin and formation of thicker skin that develops in those areas, and it looks different. It's changes that happen to our feet and the condition of our feet. Heel spurs, again, another abnormal growth within the bone, within the tissue that causes severe pain. So individuals who are walking and standing and all of a sudden develop this severe pain, it's not normal. If we stand, if we go for a walk, we shouldn't be having severe pain. Another condition very common to the feet is ingrown toenails. And this is a condition that happens either on both sides of the big foot, the big toe, and again, very painful to touch. Even putting shoes on, it could be very uncomfortable. And all these conditions, the key message here is Once things start to happen and you develop conditions of the foot, you need to now recognize and realize that they're not normal. So we'll talk a little bit about how you progress and what you need to do with these signs and when you need to seek speaking to a healthcare practitioner. I wanted to touch on something again that's really important when we talk about foot care, and that's for individuals who have diabetes. And diabetes foot care is extremely important for individuals with that condition, because a lot of times people with diabetes are very vulnerable to infection, and they will be more severe than an individual who may not have the condition of diabetes. You should be examining your feet daily. We have our showers, we have our wash, our bath every day. That is the opportunity also to ensure that we're examining our feet. Having good habits, not only for individuals who have diabetes, again, but for individuals on a regular basis. And as we age, we may not be as flexible. And so we may not have the ability to sit down and be able to look at the underside of our foot in between our toes and things like that. So we want to make sure that we are checking our feet on a regular basis. We want to look for things that are abnormal. Our skin, no matter where on our body, always should be intact, so that there shouldn't be cuts, there shouldn't be cracks, there shouldn't be blisters. There shouldn't be sores and unusual markings. And as we start to see those, they should be triggers for us. Individuals who may not have the ability to, sit down and be as flexible and take a look at their feet as detailed as they should, they may be able to use a mirror. So a great tip would be to take a mirror and place that mirror on the floor, and then actually put your foot over top of the mirror, and then that reflection can come back. So there's certain tips that people can build into this regular routine, but foot care should be part of a regular routine, especially as we age. Clean, a cut and a scrape with mild soap and water. We don't necessarily need to use all those lotions and potions, but the simple remedies of soap and water, and putting a dry dressing on and keeping it clean and preventing things from going into that open area is extremely valuable for when we talk about foot care. Other normal practices and good habits that we should be taking into consideration when we talk about foot care is trimming the nails straight across. So again, earlier I talked about a condition, ingrown toenails, and that can be related to a couple of things, and one of them could be actual shaping of the toenail. So it's important that we cut our toenails straight across. Washing your feet daily, drying them extremely well, and that means between the toes. And as we age, we'll see different changes to the physical look of our toes. And sometimes one toe will move over top of another, but it becomes important that we continue to wash and dry very well in between. Lotion, again, is extremely important. Moisturizing the feet, moisturizing the skin, and choosing a proper lotion. And it's important to have that communication if you've got conditions with your healthcare practitioner, with your pharmacist, because if you go to a pharmacy, a lot of times you're going to see a wide array. The key things are avoid the alcohols and avoid the scents. And if you can get as plain as possible with things that you're applying to the skin, it will be best for your health in general. Changing your socks on a daily basis, wearing supportive shoes, again, are extremely important. And years, previous, a lot of times as we age and we look back on our previous years or our careers, and, we may have had to squeeze our feet into very tight shoes or confined shoes or those lovely high-heeled pumps, but they may not have done so well for us as we start to age. And so it's important that we wear proper shoes that fit properly, and the toe actually should be about a half of an inch from the end of the foot, and that there's enough space so that there is good spread of the toes within the shoes as well. Avoiding extreme heat, avoiding extreme cold. So again, things like walking on the hot pavement in bare feet may not be a good practice for our feet. Regular exercise. Again, I talked about a condition, swelling, edema. So again, regular exercise is good for our entire body and our health, but also for our feet and maintaining good health of our feet as well. Consulting your healthcare practitioner with any condition. So you start to notice things that are different. Then you want to make sure that you consult a healthcare practitioner. And make sure that you are keeping notes, writing things down. One of the tips that I always give in every one of my talks is how important it is to have a journal, a healthcare journal, a health management journal. And what you want to do with that is make sure that you are keeping notes so that you can communicate back to your healthcare practitioner. It's like going into a very important meeting, going and seeing your healthcare practitioner. And when you're prepared with your questions and you've written down your concerns, you can then bring them up and not get home and think, oh goodness, I forgot to mention that little spot that I've noticed on the bottom of my foot. I wanted to talk a little bit about foot care tips and some of the things that we shouldn't be doing and some of the bad habits that we tend to develop. And if we look at why it's important to maintain a good, healthy foot, when I talked about all those things that can happen, the conditions that can happen, all those important structures that are within our feet. And if one thing changes and one thing happens, we may not be able to get out on a regular basis, go to our aquafit, put our running shoes on and go for that jog, go for that beautiful hike with our grandchildren, or take our dog for a walk. So developing good habits are extremely important. One of the things that I do not recommend that people do is treat some of these conditions without consulting a healthcare practitioner. Within the organization Bayshore Healthcare that I work for, we have foot care nurses, and there are professionals out there that are trained in order to understand the condition of the feet, do those proper assessments, and from there be able to put a care plan into place and care for an individual's foot or the condition that they may have acquired. The success of caring for and treating the condition appropriately allows that individual to get back on track a lot more quickly. Things like treating corns and calluses and bunions and ingrown toenails may not be a good practice for people to develop. There are certain things that become important when we start to break down the layers of the skin. And if we end up nicking the skin and we open up and we create a wound, now we've created another condition that in turn would need to be treated. Especially when we talk about individuals that have diabetes. Individuals that have diabetes do take longer to heal, and they have the potential to injure themselves easier than an individual who may not have diabetes. And once you've developed this condition and you've opened up the skin, and you also have the potential for infection. So make sure that you are speaking to your healthcare practitioner, you are accessing a foot care nurse. Be sure not to apply extreme heat. So I talked about that earlier as well. And sometimes we may run into situations where we think, I've got a wonderful gift and it's a foot bath, so I'm going to fill it up, and we may not test the water before we put our feet into it. We can put ourselves into jeopardy. So there's a lot of things that we need to consider when we are doing good for our feet. We may also put ourselves at jeopardy. Conditions like extreme weather that we seem to experience here across our wonderful country of Canada. Again, wearing proper clothing based on the winter weather or the summer weather or the extreme weather changes that we can experience. Soaking your feet is a good practice, showering, having a bath, but again, we don't want to go from one extreme to the other. If we soak our feet for greater than 20 minutes, we start to change the consistency and the structure of the layers of the tissue of the skin around our feet. So it's important that we monitor. And, sometimes we may actually experience that by noticing our feet when we've come out of, a water sport, and we look down and we see, a lot of white around our feet. So we know that we've exposed them too much to the water. Another thing that I think is important is we always should be wearing shoes on our feet. Bare feet is just a hazard that we are putting our feet into. And so if we're walking barefoot and we step on something and we may not have this sensitivity because of a certain condition that we have, we may not even realize that we've cut our foot until somebody says, oh, your foot is bleeding. So it's important we always have our feet covered. One of the things that I also wanted to talk about is when it is important to either access a healthcare professional or a foot care nurse through Bayshore Healthcare. Individuals who do get into that good habit and start to practice regular checks of their feet. Once they notice something that has changed, that's the key to pick up the phone and book an appointment or have a foot care nurse come by. If there's a sore on someone's foot and it develops into an infection. So how do we know when an infection develops? Normally the tissue is closed. So if there is a cut and an opening, we will start to see the gaping of the tissue. As that tissue starts to spread and the infection moves in, we're going to see things like redness, things like swelling. There may even be heat involved. And you will notice that that's just not normal. Well, we've all cut our skin and had sores on our body. And we start to notice it getting better. And if you notice the opposite and the healing is not happening and the sore is looking worse, there's a discharge, there's the redness, the swelling, and the heat involved, you know that you have an infection of the skin. If you develop that pain, and again, when we as children, as we grow up, we normally do not have the experience of pain in our feet. We can run, we can jump, we can hike. But as we develop pain, no matter where it is on the foot, it's not normal. So again, we need to make sure that we are reporting that back to our healthcare practitioner. Unusual coldness, cramps, numbness, tingling, and that discomfort, decrease in sensation. A lot of times people will say, I used to be able to feel my baby toe, but I seem to be numb there and I don't have that sensation. And especially if that sensation migrates and moves through the foot and gets worse, it becomes extremely important that we make sure that we are reporting this. These types of symptoms are not normal for the feet. Other things that I think are important is that, as I said, that sensation. And if we do experience a sore or a cut and we haven't noticed it, and maybe, a loved one or a family member tends to notice that we've got a sore or an opening on our foot and we don't even feel it or experience it, then that becomes another sign for us to go out and make sure that we are speaking and having that conversation with our healthcare practitioner. The skin on our feet and our legs, if they start to change color. So a lot of times as people go down that aging journey, they will notice different things happening within the circulatory system of our body. And if we figure our heart is kind of central, but in, the upper region, it's got a bit of a ways to go to get down to our feet. And so if things start to happen and we have discoloration, we have the swelling, we know that that circulatory system is not working as effectively as it has in the past because the swelling and the discoloration are not a normal part of our healthy feet and healthy conditions. The other thing with regards to discoloration is noticing the immediacy of that change. And if we start to notice this discoloration changing very rapidly, migrating up the leg, we need to seek medical attention much more quicker. So again, the key messages here that I always give out is people really need to pay attention to their body and the signs and the symptoms that our body is giving off, because they are symptoms to say, things are changing, things may not be normal, there may be a condition, and there may be something that we need to look into. And a lot of times these conditions can be easily remedied with quick response and quick action. A lot of times we think, oh, you know what, I'll manage, I'll just limp for a little while, but we shouldn't. Take those signs and act on them, because the healthier your feet are, the better you are in the long run, being able to maintain your regular activities. The final message that I do want to leave is the importance of healthy feet. And if we have healthy, pain-free feet, it will help you maintain your balance. It will help you maintain your physical activity. It will help you actually prevent things that could turn into other conditions that could be more significant to decreasing your health and your ability for wellness. So if we think about balance, and if we're limping, what is that actually doing to our body? And it can be a chain reaction, and we start to feel other things happening in other areas of our body. Having good balance also is the key to preventing falls. And if we can remain upright and we have the flexibility and the strength within our body and our feet, which holds our body in the upright position, we're going to prevent and decrease the risk for injury and potential hospitalization. Healthy feet allows you to stay active as well. And so take the time to put your feet up. Rest, decrease that stress, increase that ability for the heart to move the blood flow through the body. And by raising your feet up, it allows your body to have good circulation and decrease some of the stress, especially active times and active days, and when you're spending a great amount of time on your feet. It also helps improve the circulation, and it's about strong bones, healthy feet, and flexibility that's going to keep us active. If we remember, good foot care equals healthy feet, which also in turn will give us overall good health. Again, I want to thank everyone and Caring Matters for this opportunity to be able to help you really recognize how important it is to have healthy feet. At Bayshore Healthcare, our key is to be able to help people maintain their health, their well-being, and their safety in the comfort of their home. We come to you out of convenience, wherever home is, and we allow you to be able to have the care, the health care that you require in order to maintain good health and well-being. Bayshore, from our perspective, we provide care 24/7. It's easy to access us through our website, www.bayshore.ca. And no matter where you are across the country, you can call us at 1-800, no, I'm going to pull that back. You can call us at 1-877-289-3997. It allows you the opportunity to call in and speak with one of our care agents and connect you with your community, because health begins in your community and carries into your home. So thank you again, and please take the time to visit bayshore.ca.